101.1 FM. The Answer. Here's your forecast on 101.1 FM. The Answer.
Still pretty hot today with a high around 94 degrees and partly cloudy skies. A front this afternoon brings a 20% rain chance and a low tonight around 70. A little cooler and less humid the next few days with highs in the upper 80s. From the Channel 7 Weather Center, I'm meteorologist Melinda Mayo for 101.1 The Answer.
101.1 FM. The Answer. Traffic.
Car towed. This report is sponsored by Mattress Firm. I-40 westbound, just before exit 194. Looks like all lanes are blocked for a car to get towed to the side. Get a king bed for a queen price at Mattress Firm. Save up to $500 during the best Labor Day sale ever on top-rated brands like Sealy and Sleepy's. Plus, get a free adjustable base when you spend $6.99 or more. Labor Day is valid now through September 7th. Enjoy your ride. I'm Tara Thomas on 101.1 The Answer.
An Arkansas talk legend, Dave Elswick on 101.1 FM. The Answer.
It's hump day, middle of the week day, over the hill day. We are now closer to Friday than we were on Monday, which means we are much closer to a 3-day weekend. Since Monday is a holiday, it is Labor Day, so we won't be going into work. That most of us will not be going into work. I work 2 days next week, and then I'm on vacation. Ken will be here on Thursday.
Yep.
Next week.
Yes.
You looking forward to it?
Yeah.
Okay. And then I'm trying to think who's doing Friday.
Not me.
Robert Steinbach. He's doing Friday, and then again Monday. Then Alan Kerr will be here Tuesday. Wednesday it'll be Ken. And Thursday will be Kim. Well, I'm going right down to... I could get really confused here saying Kim, Ken. You know, it could get confusing, guys. Really do. So how you guys doing today?
It's a beautiful morning.
It is.
Yep.
It's hard to get up early like
We'll
this.
see
It
what
really
it looks
is.
like when the daylight gets up, but it's a beautiful morning right now. So.
Is it raining out? My phone kept telling me it was going to rain for the next hour.
It was dry.
It's dry out. It's evaporating before it gets to the ground.
It was dry. Minus someone almost hitting me in the parking lot, but it's okay.
I'll tell you what, coming over the river bridge today was an interesting experience because they put barrels out and took the two right lanes away, and they had a truck out there that had a lit arrow say move left. And why people couldn't figure it out, the barrels were pinching down, so that meant keep going over to the left.
Yes.
From those, some dude, I don't know who it was, decided he was going to stop in the middle of the bridge. I almost stopped in his rear seat. Came really close to it.
Probably the same guy that almost hit me.
Yeah,
in
it
the
might
parking
be.
lot.
He wasn't driving an orange car though. That wasn't happening. He was in a truck, a white truck.
I'm amazed of how people just don't know how to drive or merge.
Yeah,
or
well, that
yield.
merging, they couldn't figure that one out. I don't know what was so tough about it. Although they need to put the barrels differently at that exit that puts you on 430 when you're going towards the west on 30 towards Dallas. That's really southbound, but they'll tell you you're going west. But that 30 doesn't start moving west until down beyond Arkadelphia. It's one of the weirdest things I've ever seen.
You just get ready to wait. It's one of those things that when it's all said and done, it's going to be great.
Yeah,
in the meantime,
I really want to see what it's going to look like because I can't figure it out. Usually you kind of look at what they're doing and you can kind of tell what they're trying to get to. I have yet to figure out.
I'm not sold of it
on.
being great because we can't even maintain the roads that we have.
Well, that's definitely a problem.
So
move over one chair, Ken. A little distance between us. But.
Yeah, this is something that you talk about, Kim, a lot of time. Kim Hammer is here. He is state senator Got him in the studio today. Got several things we want to talk about. First thing I want to talk about, I've had Dr. Yamauchi on many, many, many times on my show. And so has Kim. Kim Hammer had him on, what, about 3 or 4 weeks ago?
About 3 or 4 Saturdays. By the way, you know why? You know why I do a Saturday noon show, Dave?
Because you don't like getting up this early.
So I don't have to get up at 5 o'clock to make you happy and come in here. That's why I do Saturday at noon.
Well, I like you to come into the studio. It just sounds better. It looks better for the people who are watching on
You just
Facebook.
don't think I'll answer the phone if you call. That's why you want to see me.
Well, I text you.
I know.
I just
I know.
text you.
He is a great
You're
doctor.
good about you're good.
He is a great doctor.
Yes. And what did he say about masks?
He said, unless you're wearing an N95, they're pointless.
Yeah, they don't work.
Yep.
They don't work. And he said if you're putting your kid in one of those blue masks, the paper ones,
Yeah.
they might as well not be even wearing a mask. And I'm thinking about this, and I'm going, so why are the school systems so, adamant about having mask mandates?
Well, they talk about how it the only thing that it would be effective on is I think Dr. Yamauchi said this is the spread of droplets, but that's also why we're taught to cough into our shoulder or elbow, sneeze into our shoulder or elbow to stop those droplets and when you need it. But besides that,
I don't even know if he even thinks it stops those. To be honest with you,
but I mean, it doesn't work.
Nope.
And the idea that let's go back to what didn't work and try it again and see what happens.
I just
that
don't get it.
concept is just, I don't understand why we're continuing to push that narrative.
And what I really take exception to is that the state legislature had all these people come in and give them all the facts and figures and everything and decided that masks don't work and say, no more mask mandates. Let's just get back to a little bit of normalcy in our schools.
Yeah.
And what do the schools do? We ain't listening to you. Oh, we're going to sue you. Okay. What are you guys going to do to them after this is over? You can cut their funding, I hope.
I don't know about that, but let me give you because here's the thing, and I'll pull it up in just a minute because I've got people that watch some of the stuff and the number of schools that have mandated masks and those that have not.
Okay.
They report on Monday and on Thursday what the number of their cases are and what their quarantines are.
Okay.
And I think it'll be this Thursday you'll get the first set of data. And what's going to be interesting to see, and I don't know how it's going to come out. That's why it's scientific, because you don't direct the outcome. You just get the outcome that you set the stage for. It's going to be interesting to see if the schools that have been masked up have fewer number of cases and fewer number of quarantines versus the schools that do not have masks, and do a side-by-side comparison. Because to me, that would be a maybe not scientific, but it will at least be an exercise to show, does it work or does it not with regards to the number of cases and quarantines. This right here, for your viewing audience, you'll just have to use your mind if you're not. This is a hospitalized COVID-19 patients in Arkansas from April to August of 21st.
Okay.
And that is the chart. Okay. And I think I've got this on, if I may give a shameless plug, the KimHammerShow.com
yeah,
website.
definitely.
If you notice from April up to December, about half of that time frame, especially when it goes to the higher side, was when we were under a mask mandate.
Okay.
Now this was the original COVID-19. What do you see with the mask mandate happening from about halfway up until December? It goes up.
Yeah, it went up.
With the mask mandate. Well, if the masks are working, then why
It
would
should
you
have
have
gone
an
down,
increase
right?
in the spike? Now, this is a scientific piece. The 1A to the 1B is when the vaccines started being given, which you see a spike still under mask mandate. You see a secondary spike, but the real drop was when people started getting the vaccine and the mask mandate came off and it held flat to the end, which the new variants came up then.
Right.
I'm just showing you this to say that even with the mask mandate, the increase in cases continued to rise.
We already have data We already have data on the schools.
Yeah.
Last school year, you had schools that had mask mandates and schools that didn't have mask mandates, and the numbers were virtually the same. And I don't know what the numbers are going to say this time. I honestly, and I think the people honestly don't care. I honestly don't care because it's a freedom issue.
Well,
You
I
you,
agree with
you can
that.
put all the numbers you want in front, but we already have numbers. This is the thing. We keep going. The Department of Health and the CDC and the WHO continue to go back to, well, what this new this new. We already have numbers. We have numbers on the inefficacy of the inability of masks that
Yeah,
working.
CDC has said that doesn't work.
No, yeah, exactly. And so we already have numbers on the schools, and then I think in even just in Saline County, you have those numbers. Senator Hammer of Benton versus Bryant last year. Benton didn't have masks. Bryant had masks. Numbers were exactly the same. I have a feeling that they're going to be exactly the same, virtually the same when they come out Thursday. So
Well, let me read you a statement.
All right. Who's this from?
I'll tell you in a second.
Okay.
CDC, set CDC aside, and I'm looking for something I'm supposed to have on one of my emails about the number of changes of position that the CDC has taken on the mask mandate, which is all over the place. So I'll try to find it before we get off the air. But here's the quote: says, "So the mask is not 100%. So my wearing the mask does not guarantee that those persons around me are not going to get it. As you know, the persons that are exposed, the mask has no protection for them. The transmission rate of this virus is 2.8, 2.5 persons per individual infected. So the only way to flatten the curve or lower the coefficient is to make sure that anybody that is exposed is quarantined, which is a whole separate issue, so that if he or she develops this disease, they will not get a chance to spread it out." That was on August 3rd of 2021 by Dr. Romero in a committee meeting where he was asked a question about the mask.
Okay.
Then you throw Dr. Cloud, state representative from up in Russellville, who made the statement in a committee meeting that the only effective mask is the N95.
Which was what
Otherwise,
Dr. Yamauchi said.
is what Dr. Yamamuchi said, which and Dr. Cloud's position was, or statement was, it was a brief statement, was that all these other masks are ineffective, which is what Dr. Romero said, which is also what Dr. Yamauchi
That's
said.
good.
So I mean, there's three individuals, three, which are doctors. So, what do you do?
Right. Right. I understand what you're saying. I just think it's a false narrative that the schools are using, that if you mask up, we're protecting each other better.
Go ahead, Ken.
no, I just wish we continue to talk about masks and we continue to talk about vaccines. And I know some of your colleagues have tried to redirect the conversation, but I wish we would take a hard right turn and redirect the conversation to therapeutics and preventatives and things like whether it's the monoclonal antibodies, whether it's ivermectin, whether it's hydroxychloroquine, and talk about those things instead of spreading these fear articles of, oh, people are calling the Poison Control Center. Well, let's talk about what the history of what ivermectin was created, the history of what hydroxychloroquine was created, and why why did we have to wait for monoclonal antibodies? Why did we have to wait for the FDA approval of the vaccines before we could have monoclonal antibodies that have saved hundreds, if not thousands, of lives at this point? And so we, never in science has our decision been two things: mask and or vaccine. And I think people are tired of those two things being the only decisions they can make to prevent themselves from getting COVID-19.
All right.
Go ahead.
I need you to hold your thought. All right. Keep your powder dry. We'll be back. We're going to talk more about this. It's on. Everybody's talking about it. I can tell you that. I had breakfast with some friends yesterday, and this was an ongoing part of the discussion. Part of the ongoing discussion was school boards not listening to the people who was putting their kids in their schools and saying, we don't want mask mandates. And I really, talking about freedom, Ken, it really irritates me when a school board president, the superintendent, says, we're going to have 25 minutes of discussion, and each side gets 6 people to talk. That is not freedom. All right, PI Roofing, don't forget about them. They'll take good care of your roof. We've been lucky this year. We've, when we've had some storms here in the area, we really haven't had any hail or anything like that. Doesn't mean it's not going to happen. I'm just saying that right now we've been able to avoid it. August was a typical August in Arkansas. It was hot, it was humid, and it was baking your roof every day. So you need PI Roofing to check it and make sure that it's working for you. So give them a call, 707-3551. They'll come out. They'll put somebody up on that roof. They'll walk around on it. They'll look for any places that might spring a leak, literally, and make sure that that does not happen. You can visit them as well online. Just go to piroofing.com.
101.1 FM. The Answer. Traffic.
Roadway still affected by a car being towed. This report is sponsored by Mattress Firm. I-40 westbound just before exit 194. All lanes are temporarily blocked to remove this car to the side. Get a king bed for a queen price at Mattress Firm. Save up to $500 during the best Labor Day sale ever on top-rated brands like Sealy and Sleepy's. Plus, get a free adjustable base when you spend $6.99 or more. Labor Day is valid through September 7th. I'm Tara Thomas on 101.1 The Answer.
News, opinion, insight. This is 101.1 FM. The Answer.
The state of emergency in Little Rock is continuing for 120 days as COVID cases and hospitalizations continue to climb. The Little Rock City Board of Directors voting Tuesday to extend it to December 29th. It also extends the city's mask requirement for anyone in city-owned spaces. Members of the Arkansas National Guard left Fort Chaffee yesterday on their way to Louisiana to assist in Hurricane Ida cleanup efforts. More than 500 Arkansas Guardsmen will help clear routes, conduct high water rescues, and provide security and traffic control. And the American Red Cross of Missouri and Arkansas is sending 4 emergency response vehicles to Louisiana to support the response to Hurricane Ida. KETV has once again partnered with the Red Cross to help in relief efforts to truly show the spirit of Arkansas. To donate, go to KETV.com. And for the latest news and weather, download our free apps. From the Channel 7 Newsroom, I'm Chris Kane for 101.1 The Answer.
It's the second annual Disaster Dash 5K, Saturday, September 18th at Murray Park Pavilion 3. The Disaster Dash is a local fundraising event for organizations that are the first on the scene to provide food, shelter, cleanup, or support for victims of natural disasters. Register or become a sponsor by going online at www.disasterdash.com or email disaster-5k@gmail.com. All participants will receive a t-shirt and finisher's medal.
Hey guys, I want to tell you about a new sponsor called Liberty Health Share. They bring healthcare programs to people through a process called healthcare sharing, and they are pretty unique. It helps people break free from the old way of paying for healthcare. Their supportive community commits to bearing another's burdens in prayer, encouragement, and financial support. So before you sign up for your next healthcare program, they have a few questions for you, starting with, what do you pay for your healthcare? Are you single? Do you pay more than $199 a month? Are you a couple? Do you pay more than $299 a month? Do you have a family? Do you pay more than $399 a month? Yes? Then you can join a program to support the health of your entire family for only $399 a month. Sign up any time of the year. Choose your own doctor and hospital. For more information, go to libertyhealthshare.org. That's libertyhealthshare.org.
Dave's back. The lines are open. 501-823-0965. The Dave Elswick Show. 101.1 FM. The Answer.
In the 7 o'clock hour, don't forget Congressman French Hill will be with us from phone in D.C., and we'll hear from Congressman Westerman as well by phone from D.C., and did Representative McCarty not lay down the law yesterday when they started talking about they were going to subpoena the phone records on January 6th for so many people, Republicans? And he said, we get the majority, payback will come. He told that to the companies that they were asking to help them. Just know that if we get back in power, that it will be bad for you. I think that's the way you got to play this. with these people. You can't let them just keep
Yeah,
kind
but
of
we
running
had to
over
follow
you.
through, you know.
Well, no, I'm not.
Yeah,
I'm not talking follow through here. I'm saying that's what Kevin said.
that's
Now
true.
I agree. He's got to follow through
Yeah.
with it.
Yeah, President Trump always followed through on his threats.
Yeah.
They weren't threats.
Yeah.
I was talking to a different state senator yesterday. It's if we take back, I think we'll take back the House.
I think we will.
If we take back the Senate,
It will be close.
It's time to follow through on these things. Time for these Republicans to actually
Do some
do
things.
things. Yeah.
Yeah, they're going to have to do some things. All right. State Senator Hammer is here. What was it that you were going to say there, and I cut you off?
I was just going to say that not all schools, and I've got a list here of the ones that are under mask mandates and ones that are not, self-imposed, because with the judge striking down the law that allowed the districts to have that local control. And the thing is, I didn't get any of my districts that really wanted the local control when it came to the mask. And I think that's pretty universal across state. They didn't want to have to be put in the position to have to make the decisions that they're having to make, and they're getting a little bit of a taste of what local control really is.
Uh-huh.
And that's not a criticism. It's just the way the cards have played out. So with that local control power, 110 have required mask mandates, 30 have required partial mask mandates, and 121 have not required any. And I don't really think it's that they believe that the masks work or not work. That's the hot topic discussion. The reason the masks are being invoked is because of the way the quarantine rules are written. And if you got a mask on, then you can bump into somebody. And that's a whole nother subject, is the confusion of the quarantine requirements and how many, times those have changed. But the reason
So
I think,
let me stop you and make sure I'm understanding what you're saying. If you're wearing masks and you bump into somebody, they figure you have not transmitted the disease to the person you bumped into.
that'd be a layman's explanation. Yeah.
And that way you don't have to quarantine
Right.
if you were bumped into.
Right.
Okay.
It's not that they're big on masks or they even think they work, because we got a plenty of testimonies that says that they don't. And I'll say this too: there are, and people need to remember, around the state there are school boards that have medical personnel on them, and not all those medical personnel agree with the requirement to wear the mask either. But it's the shell game, if you will, that if you're wearing the mask and you can't maintain 6-foot distancing, then at least if you got the mask on, you're okay. And I think that's the reason for why the vast majority want the mask mandate. Not so much because they think it works, but it is the end around to get around the quarantine so that you don't have to send the kids home.
So that
based
you
on the
make sure
quarantine.
you still get your money from that student from the state, right? That they're there, they're reporting, they're at school, so that money's still coming to the school.
Hey, everybody I've talked to,
It always comes down to money.
I know it always follows the money, but the big concern on the people that I've talked to is they understand the negative impact of those kids being home. A lot of them unsupervised, some of them unfed, undisciplined, and falling behind in their education.
Mm-hmm.
They're concerned about the welfare of the kids. That's why they want them in the schools.
Ken, you think that's what's going down?
I don't think the school or the majority of the school districts are that smart to make
I think
that
it's money.
to make that decision of quarantine, not quarantine, mask, not mask, or whatnot. Senator Hammer was telling me, why Benton was better than Bryant a while ago about.
Hey.
Just kidding. That was
Getting
a joke.
him in trouble,
That was
man.
a joke. Benton doesn't have a mask mandate and Bryant does, but it's. I think people need look. The school boards. We talk about local control, and I believe in local control. The local control is supposed to be with the parents and the individual. But the school boards were never elected to make medical decisions for the children of the school district. They're elected to make educational decisions, and so this is where these decisions on mask mandates. This is not within the purview of the school boards, in my opinion.
All right. I want you both to keep your powder dry. We got to take a break. We got to get to the news, and we're going to come back. And I want to talk about how some school boards are handling the parents that don't, and that either want masks or don't want masks, and they have these meetings, and then they don't let people talk. I want to talk about that when we come back here on the Dave Elswick Show. It is a Wednesday. We're up to 6:30 already. We got more to talk about when we return here on the Dave Elswick Show.
Hands on the wheel, eyes on the road, and your ears right here for the most up-to-date traffic reports. 101.1 FM, The Answer.
Hey, my thanks to the good folks for East End Towing joining the Dave Elswick Show. They want you to know a few things about towing. First, road safety. What should you do when you have a broken down car? Well, you want to pull to a parking lot or over on the right shoulder if you can. Look around for hazards on the road. Tow operators have been killed out on the road, so slow down and move over campaign is going on right now. If you see a tow truck on the side of the road working with a car, get over in the other lane and get as far away from them as you possibly can. Arkansas Tow and Recovery Board licensed and insured tow operation. Each truck is permitted and has maximum standards on it. No matter the situation, East End Towing can handle it and has all the answers. Call them 501-888-8849. That's 501-888-8849.
Take The Answer with you anywhere with our free mobile app. 1011fmtheanswer.com. Tune in, iHeart, or radio.com. Breaking news and stimulating talk. 101.1 FM, The Answer. Dinesh D'Souza can teach you a thing or two.
They're just chanting death to America, but they seem friendly at the same time.
Where have we heard that before? Well, the first time I really heard it was during the hostage crisis. Remember? Jimmy Carter, in which this superpower, America, is just being humiliated day after day after day. Well, those days are here again.
The Dinesh D'Souza Podcast. Available on SalemPodcastNetwork.com and everywhere podcasts are heard.
Listen to Up in Your Business with Carrie McCoy at our new showtime every Saturday at 11 a.m. on 101.1 The Answer for live interviews that celebrate the American dream. This week, tune in for a special interview with the mayor of Little Rock, Mr. Frank Scott Jr. After touching on his early life and career, Carrie and the mayor discuss the ins and outs of his renewed Rebuild the Rock campaign aimed at revitalizing the city of Little Rock. Listen to find out how the proposed sales tax would improve early childhood care, create a senior center, revitalize our parks and recreation facilities, and improve infrastructure, all while learning some interesting facts about our fast-growing city along the way. Brought to you by flagandbanner.com. Up in Your Business with Carrie McCoy, now airing Saturdays at 11 a.m. to noon on 101.1 The Answer.
You want great deals? We've got great deals. DealsForLittleRock.com is your site for discounted deals on food, services, private school tuition, and so much more. Visit DealsForLittleRock.com and save. St. Clarity Residential Cleaning has been known for quality services and the highest level of professionalism. Right now, get a $200 gift certificate for $100 or $300 for $150. DealsForLittleRock.com. Get great deals right now at DealsForLittleRock.com. That's DealsForLittleRock.com.
Here's your forecast on 101.1 FM. The Answer.
Partly cloudy skies today and another hot one with a high up in the mid-90s, a 20% rain chance with a front coming in. And tonight slowed down to 70. That front cools us down a little bit the next few days, upper 80s and a little less humid. From the Channel 7 Weather Center, I'm meteorologist Melinda Mayo for 101.1 The Answer.
101.1 FM. The Answer. Traffic.
Still dealing with a car being towed? This report is sponsored by Liberty Mutual Insurance, where you only pay for what you need. I-40 westbound just before exit 194. Looks like all lanes are temporarily blocked to move a car to the right. Nobody should have to pay for one-size-fits-all insurance coverage. Liberty Mutual customizes your car and home insurance, so you only pay for what you need. Visit libertymutual.com to learn more. I'm Tara Thomas on 101.1 The Answer.
Stimulating talk with Dave Elswick. 101.1 FM. The Answer.
All right, don't forget about Cabot Emergency Hospital. They've been a good place to go. A lot of people have been going to the hospital there, dealing with COVID to get shots and to be treated and things of that nature. There was a lady over at the Lone Oak GOP meeting the other night who said that if it hadn't been for Cabot Emergency Hospital and the treatments that they were able to get to her when she went over about COVID, she thinks that she'd be dead right now. They have board-certified emergency physicians with over 130 years of experience on duty 24/7, 365 at Cabot Emergency Hospital. They're going to be able to do good things for you. Yes, they are open to holidays. If I say they're open 365, that means they're open on holidays as well. They've got x-rays, CT scans, ultrasounds. They've got an on-site MRI, on-site lab. They've got the pharmacy, and they will get you in the back and get you treated post-haste. It won't take a long time. Not like going to some of the emergency rooms going on right now here in the city, which you can be sitting for 45 hour and a half waiting to get back to the back. So get back to life faster. You don't have to wait. The folks at Cabot Emergency Hospital take good care of you and remind you that your emergency matters to them. All right, let's continue. I talked to Ken and to Kim Hammer here just a moment ago. Kim Hammer, state senator from the Saline Bryan area, Saline County Bryan area. Then you got, of course, Ken Yang here. He's the chairman of the Saline County GOP. He's also the chairman of all the chairmen here, the chair of the chairs.
Yes.
That's how it's said, right?
Yeah.
Chair of the chairs of the GOP here in the state of Arkansas. And something that has been bothering me, it bothered me about what I saw happen in Cabot. It's bothered me what I saw happen in Whitehall. And that is restricting people who come to make their statements to the school board and to the superintendent. And this doesn't just go for school boards, all right? This goes for any reason. People are always bitching at people for not showing up and wanting to take part in, the political process. Then when they show up, they put controls on them. In Whitehall, only 6 people from each side could talk. And there in Cabot, they had a meeting a couple of weeks ago, I think it was. It was going to be 70 minutes long only. And, if you got in, you got in. If you didn't, tough luck. I think you should sit there and listen to everybody who shows up. I mean, they took the time out of their day.
Yep.
You're there if you're a school board member because you asked to be elected to the school board. If you're the superintendent, you're being paid good money to be there.
Yep.
And listen to the people. I know how you feel about this, Ken, so I'll start it with you, and then I'll turn it over to Kim Hammer as well. What do you think?
Well, I think you're right. They the letter B and moan about it all the time, and people finally show up. And it's not just mask mandates. It's literally any issues, tax increases, or whatever it may be. And then they limit the amount of time you have to tell them how you feel. And they think doing this equal thing, well, we'll do, 6 on this side, 6 on that side is fair. That's not fair, because there may be 100 people show up for one side and only 15 people show up for the other
6.
side.
6 for the other
Yeah.
side.
And that, that's what they do, and we see that all over local government as people complain about stuff. And it happened in the city of Benton when we were just talking about the AMP tax, and our Mayor Farmer passed a 20-year AMP tax without the vote of the people, and he gave people 3 minutes to speak on it. And that's happening when it comes to mask mandates. People are limiting people's ability to speak on it. Parents that
Pay the money.
that pay the money that the school districts answer to, they're limiting their free speech.
All right. Senator?
I never like it when people show up for a meeting and they don't get a chance to talk. And I'll address it from like the state capitol level.
Sure.
We, when we're in session, we have some long meetings, but we also have people that take off work. They rearrange their schedules. They, in the case of state business, they drive in from a long distance. I don't think it's respectful to disrespect them by only limiting them to a few minutes. So I think that if people show up to talk, they ought to be able to be given the chance to talk. I do think maybe some perimeters maybe should be established, but it's not something that should be unreasonable where you got a room full of people and you're on. And what's the intent? You got to ask what's the intent. Is it that I want to choke down what you want to say so that I can control how much you get to say so I don't have to hear what you want to say?
Right.
Is that the motive? If it is, that's a wrong motive. And sometimes people just want to vent and get it out, and you really make the problem worse by not giving them the time to speak, because then if they don't get their way, but they feel like they didn't get their voice in the process, you got a big problem next time around. So I'm on the side of if they show up to speak, give them a chance to speak. I would also say this: if you're going to speak in a public format, come with some decor as far as ability to not get ugly or turn it into a big brawl, or because your message.
No, at that point, you can be cut off.
You can be cut off and you can be escorted out of the room if you're not going to show some, be civil about what you want to say, have your thoughts organized. And if 20 people say the same thing, take that in consideration, because after the 10th time, you got your message across and nobody's listening to you anyway.
Yeah. No, I agree. And when let's be honest, when you go up there and act a fool, you ruin it for your side. Actually,
That's right. That's right. People, you're branded by how the worst person in the room acts.
Yeah. Yep.
Keep that in mind, by the way.
I'm
I've seen some pretty bad actors lately.
Yeah.
To be honest.
Yeah.
I mean, I won't say which school board meeting it was, but they were meeting, and one of the school board members say, "You think you can do better? I'll just step down. You guys take over." And several people of the audience stood up and said, "Okay, step down. We'll take your place." Yeah.
And listen, me. I want to be fair. I want to be kind and all that other good stuff. But being a school board member is about the most thankless position you can also have in an elected position.
Correct.
And there are a lot of good school board members out there that take a real beating, that are right. I mean, they're on the right side of whatever the issue is, but they still take a beating. But at the same time, when you put yourself in a glass house, get ready for the stones that are going to be thrown. And you almost have to go into every meeting expecting that somebody is going to be looking to push your buttons and try to bring you down.
Somebody's ox has been gored.
That's it.
That's the way it usually works. That's true. And it sometimes you don't like what the people may say back to you in positions of power, and that's what a school board member is. You've elected them to a position of power, but it may be that they're just following the law. Now, many instances they're not. It's just they're making the law as they go on. But here's the other thing I've been saying. Because of redistricting, there's going to be an election for every school board member that's serving across the state of Arkansas. And if you don't like the superintendent, then you need to get the people on the school board that's going to get rid of the superintendent. Just know that the buyouts are expensive. It's the way they work because of what they give them now. I mean, they pay I'm going to make some people mad. They pay you way too much money for what you do. Just being honest. How many of you got, free membership at the country club? How many of you got, free car use and all the other things that they give to you now? It's ridiculous. Absolutely. $175,000 a year. I've heard from some superintendents, and I'm just looking at them going, don't think that's right, but okay, they agreed.
Half of them don't even last.
Yeah. Well, they're always looking for a bigger paycheck. Most of them are.
I would say the ones that embrace their community and make their community their home and are invested in their community and connect with their community and they live in their community are the ones that seem to have the longevity. They become one with the community because then they're checking the pulse of the community.
Yeah, they know what's going on.
They know what's going on, and the community knows that they have a voice represented in that superintendent. That's why it's important, not only on the superintendent level, but all administration level and teachers that institution reflects who the community is.
All right, need to get our final break in, and when we come back, my last question for you guys that I had in mind was, how do we get the politics out of COVID? I don't know if we can. But that's a question. How do we get the politics out of COVID? We'll talk about that when we come back here on the Dave Elswick Show. I want to remind you about David Lucas. If you got questions about filing for Social Security, David's got the information for you. He's got a booklet called Your Guide to Social Security. It's from the David Lucas Financial Business in North Little Rock. It's 27 pages long. It outlines what you need to know. It can help you get even more income when you file for Social Security. So if you're within 5 years of filing for Social Security, get this free booklet now by calling 501-222-3315. And as a bonus, you're going to receive a free customized Social Security analysis that pinpoints the optimal time for you, not somebody, your neighbor or a friend of yours, but you, to wring every nickel out of your benefits. Pick up the phone, call them now, 501-222-3315. That's 501-222-3315.
101.1 FM, The Answer. Traffic.
Still dealing with a roadway block. This report is sponsored by Liberty Mutual Insurance, where you only pay for what you need. I-40 westbound before exit 193. It looks like a roadway is blocked while they're towing to recover a vehicle, so watch out for that. Nobody should have to pay for one-size-fits-all insurance coverage. Liberty Mutual customizes your car and home insurance so you only pay for what you need. Visit libertymutual.com to learn more. I'm Tara Thomas on 101.1 The Answer.
101.1 FM, The Answer. Take The Answer with you anywhere with our free mobile app. 1011FMTheAnswer.com, Amazon Alexa, iHeart, or radio.com. Breaking news and stimulating talk. 101.1 FM, The Answer.
Do you have questions about filing for Social Security? Hey, it's David Lucas from David Lucas Financial in North Little Rock. 96% of Americans lose out on an average of $111,000 in Social Security income. And that's why I wrote a simple and easy to understand booklet called Your Guide to Social Security. This 27-page booklet takes the complication out of filing for Social Security and makes it simple and easy to understand. If you're within 5 years of filing for Social Security, get this free booklet now by calling 501-222-9841. And as a bonus, you'll receive a free customized Social Security analysis that pinpoints the optimal time to wring every nickel out of your benefits. This is a $975 value, and it's free. Call 501-222-9841. 501-222-9841.
101.1 FM, The Answer.
Hi, I'm Jason Rapert with Save the Nation. I want you to join us right here on 101.1 FM The Answer, weeknights 7 to 8 p.m. We discuss every single issue facing our country from a biblical worldview. We need godly leaders if we're going to have a godly nation. Join us here for Save the Nation.
This is Uplift.
Pastor Greg Laurie here. Do you ever worry that we're living in the end times and you see events happening around you that kind of scare you? Bible prophecy is not given to scare us, but to prepare us. We have a choice. We can either look up or we can freak out. Here's what Jesus said: when you see these things begin to happen, look up and lift up your heads because your redemption is drawing near. As believers, we can live with the hope of the return of Christ and look forward to the salvation that he offers. So don't freak out. Look up.
101.1 FM. The Answer. Dave's back. The lines are open. 501-823-0965. The Dave Elswick Show. 101.1 FM. The Answer.
So the phones are open if you got something you want to say. If we touched a nerve today, feel free. 823-0965, 823-0965. And like I've said all along, it's just like when I talk about getting the vaccination. You want to get the vaccination, be like me and get the jab. If you don't. You know, it's up to you. You can make the decision on that. But don't complain to me also about, I can't believe businesses are telling people that they got to get vaccinated. That's been going on forever, all right? That's not just now. That's been going on forever. And I still find it humorous that I've been contacted by so many people who say, can you believe the military are making these guys get that vaccination?
Yeah.
And I'm like, I was in the military. If there was a vaccination that came out, we got it. Man, when I went into the military, I got it. I lined me up and filled me up with everything they could think of. And you don't have to go back that far to look at when anthrax popped up a few years back, that they made all the military get those vaccinations. So military men and women don't like getting them any more than you do. But
well, there are exemptions. You know, someone reached out to me from Fort Smith, and their son's in the military, and they wanted to talk. And there's code that talks about religious exemptions in the military. And so I sent them that part of the rules and part of the code for the military, and they had a meeting with their chaplain, and everything's taken care of. And so that's the trick of instead of just inciting all this frustration, find out what you can do about it. I think the frustration with the businesses part is typically in the past, even though businesses mandated certain vaccinations, they've made reasonable accommodations for its people.
Mm-hmm.
Right now, that's not being done.
Well, and I talked to HR with a large company that employs a lot of people here in the state, and they have a policy as far as objection, and there's a process forward. Now, you know, is it going to rise to the level of a person's individual objection, whether on religious or conscientious or medical? You know, that's a case-by-case situation. But most companies have a policy. They should have a policy. If they don't, now's a good time to get one and get a policy in place so the employees know what it is. When I worked for a hospital for many years, I was required to get a flu shot, or I couldn't go out and see patients. And it was just a known fact that you got to have your vaccine in order to go out. You know, hopefully with FDA approving the one, it'll alleviate some of the concerns as far as the long-term, you know, concerns about what are the effects of it going to be.
Yeah. My only problem is I've yet to be able to find glasses that have 3 lenses. But, you know, the third one goes on the eye and the back of my head.
I know.
All right. With that said, how do we keep from this being politicized? Because it has been politicized. There's no doubt about that. Let's start that off with you, Senator Hammer.
I don't know that you can. I don't know that you want to, because if you remove the elected officials from the conversation, what if this would have happened without us being able to have some weigh in on it? Now, I know some people are going to say, you know what, you're not a doctor, you're not a nurse, you're not a whatever. But we get a lot of advice from a lot of good doctors and a lot of good nurses. And I think what the position that we're in, we have to exercise good judgment and try to have something in the way that would back up the decisions that we make as to why we do things. I don't know that you really want to remove the political. It's just the consequences of living in freedom. You got to have an environment sometimes where iron sharpens iron, and, you know, let the sword cut whichever way it's going to cut. So personally, I don't see how we can keep it out of it, because especially when they come asking us for money in order to do certain things. You can't keep politics out of something like this. And I think it's important that you have, you know, politicians that'll be at least level-headed, look at everything, have a good reason, a rationale for the decisions that they make, and then just try to work together as a team to get to the overall goal, and that is we want to get this thing defeated. Personally, I wish some of our senators or congressmen would begin the action of crimes against humanity against the people that did this, because to me it's as worse as a war crime. That's Kim Hammer's opinion. I may be proven wrong, but I think somebody's head needs to roll on this one.
All right. With that, we'll turn it over. Last say on this whole subject is going to come from Ken Yang.
Yeah, it's going to be politicized, but the way to solve, in my opinion, everything is to stop listening to the liberals, stop listening to the Democrats, stop listening to these liberal doctors and nurses that have an agenda, that are pushing this vaccine without answering questions. You're going to push something, but I think the people just are angry about just questions not being answered. I think medicine lives in a whole different world when we talk about mandating vaccines for private businesses. Which employer mandates is a dangerous thing because it's something new. It's not like telling people to get the polio vaccine or smallpox vaccine, which things had years of research. And so if we stop listening to the liberals, we stop listening to the WHO that's run by China, we stop listening to CDC who's changed their minds. More so than Dave uses the restroom.
At my age, that's a lot.
And so, if we stop listening to those things and start demanding questions from our leaders, from people like Dr. Romero, from Dr. Patterson at UAMS and others, I think we'll go down a lot better path because science is science. And the fact that we don't talk about natural antibodies, therapeutics, other things besides a shot is beyond me.
All right. To the senator, he wanted to talk a little bit about nursing. Or nurses.
Yeah, and to the subject, Ken, if I get my stuff together between now and tomorrow, or before Saturday, ivermectin is going to be a topic of my show. Have been talking some, and I think we need to have the conversation, because the worst thing I think you can do is have something that you kind of like going to a board meeting, not getting a chance to talk. If you've got something that people are concerned about or want some opinions about or get some information about, I think the worst thing to do is just not talk about it at all. But if everything comes together on Kim Hammer show this weekend, we're going to be talking about that. I've got some people calling in that are going to be able to speak on that. To the nursing fact, people need to understand we are in a severe nursing shortage. I've sat through enough meetings to know this is the real deal. And these nurses and the folks working in the hospital, keep the politics out of it for their sake. They're just doing what they're called to do. And we need to support our staff. Now, some would say, well, you just said, masks don't work effective. Well, I'm taking it on the evidence of people that, that are professionals just as much as the people are professionals saying it does. But at the end of the day, we need to support our nurses, and we are seeing nurses leave the field. And if we want to have a good future, like 3 to 10 years down the road, we need to re-engage people back into the nursing field, back into the medical field, because we all depend on them. So I nothing else, wanted to give a shout out to all the medical staff.
Okay, we got 1 minute. You wanted to say something about hospitals.
Just that I get a daily report on the hospitals sent by somebody, and it is the real deal as far as the number of beds that are occupied. The good thing is it's starting to level off, but the ICU beds of COVID patients is still at critical level. But as far as the old numbers, we're starting to see the plateau and it start coming down. But when you hear these reports about these hospitals being maxed out, you can believe it's true. They're maxed out and they're hurting, and anything you can do to support them would be a good thing.
All right. We're out of time.